thank you to all the previous speakers who've obviously covered various aspects of the bill. So I thought it might be useful to look at the extent to which previous reforms have been limited their impact, not least because of the role of campaigners, and to just put the current bill in a little bit of context. 30 years ago, the Thatcher government was launching the internal market system that first allowed hospitals to opt out as self-governing trusts, trusts which were required to compete with each other for contracts. Larger GP practices then were also encouraged to opt out by becoming GP fund holders with budgets for elective care. The internal market meant pricing and billing of treatment between trusts. Cash limits were imposed on most primary care for the first time. Trusts were encouraged to break from national pay agreements and negotiate local deals. Oh, and this was also the NHS and community care bill that created today's nightmares in social care by pushing long-term care for older people out of the NHS, where it was free at point of use, and into local government, where it's subject to means-tested charges, and with care homes and home care increasingly fragmented and privatised ever since then. What happened? Well, huge amounts of bureaucracy was added to the system. Huge sums of money were wasted or pocketed by fund-holding GPs holding onto the funds. Waiting lists stayed high and went higher. But other than long-term care, almost no patient care was actually privatised back then. The unions almost everywhere beat back plans for local pay. Skip forward 10 years, New Labour's 2000 NHS plan seemed to set course for wholesale privatisation again. New hospitals were being financed through PFI. Targets were set for 15% of all NHS elective work to be done by private providers. Independent sector treatment centres were set up. Corporations began buying their way into GP contracts. Virgin's GP practices then covered more patients than Centene does today. United Health tried to move in on GP contracts from America. From 2005 onwards, commissioners were instructed to hive off the community health services they were still mostly running to any willing provider. We were so concerned back then as campaigners, we set up Keep Our NHS Public to challenge all forms of privatisation. And the pressure we brought to bear played a role in limiting how far New Labour could go. But we had help because the most corporate GP contracts weren't profitable and collapsed. The treatment centres were controversial, much more expensive than NHS operations, and unpopular. Most of the NHS still remained firmly in the public sector. Then came David Cameron's coalition, which proposed a massive top-down reorganisation to entrench the NHS into a rigid competitive market system, requiring local commissioners to put contracts for anything costing more than £600,000 a year out to tender. Lots of people listening tonight will have been part of the campaigns against the Lansley Bill. It split England's NHS into 207 clinical commissioning groups, initially with GPs being notionally in control, but in fact often run by management consultants. It empowered foundation trusts to make up to half their income from private medicine. It required all NHS trusts to become foundations. We saw it as a threat. 10 years ago, I wrote the headline, "Kill Lansley's Bill before it kills the NHS." Back then, there was a real chance right up until the end we could kill the bill if we could just break off the Lib Dems from the coalition. But what actually happened? Bits of the bill were watered down. Sections of the Act simply couldn't be implemented, not least all trusts becoming foundations, and are now being abandoned. Big privatisation schemes in Cambridgeshire and Shropshire and the franchising of Hingingbrook Hospital Management to Circle all collapsed because they weren't profitable. No foundation trust has even got close to making half their income from private work, although several are clearly trying to do so. Many small-scale community contracts were privatised, while most larger contracts, especially those involving risk, remained in the NHS. The spending on private providers has grown, but as a proportion of NHS England spending, it's levelled off. Not including GPs and dentists, 18% of clinical spend is with private providers. A lot of people think it's a lot higher than that, but actually that's where we are. From 2014 onwards, NHS England began looking, in other words, the year after the bill became law, NHS England began looking not to break the NHS into more piecemeal contracts, but to bring together specialist services like pathology, imaging, diagnostics, and technological support into profitable framework contracts, which could be awarded without tenders or competition to pre-approved lists of providers. These same ideas are now in the Health and Care Bill, which we oppose for the reasons many people have voiced this evening. I'd sum up my concerns this way. It doesn't end or reverse privatisation or even competitive tendering, but it could allow private health companies to sit on boards of ICSs. It gives the Secretary of State sweeping new powers, but it doesn't reinstate the duties to promote a comprehensive service that was swept away back in 2012. The reduced number of integrated care systems drastically reduces local voice and accountability on cuts and closures for councils, communities and constituencies. The bill leaves foundation trusts free to ignore local plans and to maximise private patient income, as some are now trying to do. It gives no voice on integrated care boards to patients, to mental health, to public health, or to health workers or trade unionists. And the proposed new payment scheme could lead to a postcode lottery on the level of funding for specific services. And new powers to deregulate professions could undermine quality and safety of care. So we need to fight against this bill because of these issues, but we also need to support the effort by opposition parties in Parliament to amend the bill to remove the most damaging bits if they can. Through health campaigns together, we've been discussing with the unions and the Labour team how best to fight the bill. Time is tight. Part 1 of the bill, including all the sections on integrated care systems, will be debated in the Commons for just 2 weeks from next week, and then the break for party conferences. There'll be no further chance after that to challenge this part of the bill until the House of Lords takes it up, and then it comes back to the Commons. Those of us with Tory MPs and Tory councillors need to hold our noses now, clench our teeth, and write to explain to them in terms they can understand why they too should urge their colleagues to back amendments on these same questions. We've got plenty of NHS to defend. We've got plenty of opportunity to organise. We've got clearly support on a wide basis for a campaign against it. Let's make sure we don't miss this chance to build this kind of pressure, the kind of pressure on backbench MPs that can get clauses and proposals dropped or amended, and ensure whatever bill may be passed in the end doesn't do the damage we fear. It's still our NHS, it's still vital. Let's keep our NHS public.